everything might not be fun.
The politicians keep saying, why is our healthcare system so expensive? And like, duh.
How does that make any sense?
We'll figure it out. This is the thing, I'm just getting totally unhinged now, and I don't know what to do. Hey, I'm a little in the dark here, so I apologize for that in advance. But I needed to talk right away about these new guidelines that came out. The American College of Cardiology has issued new guidelines about blood pressure. And I like to say, I went to sleep one night, and when I woke up in the morning, 30 million extra people had a diagnosis of hypertension. That's exactly what happened. The American College of Cardiology lowered what is considered hypertension or high blood pressure from 140 down to 130, instantly making 30 million more people hypertensive, which is about half the adults, and about 80% of people over 65 now have a diagnosis of hypertension. I need to talk about this because this really gets to the heart of everything we're going to talk about in lots of ways. The New York Times published a front page article about this, of course, saying these new guidelines, and now people are going to have to get serious about treating their new blood pressure because all these people were now diagnosed as having high blood pressure. And they used some numbers. They quoted expert doctors, and you'll be hearing a lot in this podcast about the expert doctors who are always quoted in newspapers. One of them said, by lowering the blood pressure numbers, we may be preventing complications in 30% of people. That's a lot. Another one said that we might be cutting death down by 25%, cutting heart disease and strokes down by 30%. We might be dropping death by 25% because now we've lowered these numbers, and we're going to be able to get people to take drugs and lifestyle changes and get their blood pressure down to these numbers. And it sounds good. All the New York Times did was quote these numbers and interview these experts. But here's the problem on so many levels. Number one, what does that mean? We're going to get into this later in the podcast, but if you reduce death by 25%, what does that mean? 25% of what? I mean, if very few people die anyway, and you reduce it by 25%, that could be a really small number. I mean, as someone who's about to change their life and lower their blood pressure, you may want to know that. And the other thing is, what exactly is pushing these people to make this decision? I mean, has there been a lot of studies all of a sudden that just came out? No. Turns out there was one study of 9,000 people, came out a couple years ago, called the SPRINT study. And the cardiologists love this study. Interestingly, because of all the other studies that are out, other than this SPRINT study, several other major organizations, such as the American College of Physicians, decided that actually, even a blood pressure of 140 was not right. That actually there's no evidence that getting it down that low would help anyone. So they upped their number to 150. They said, actually, all we should aim for is to get people below 150. And as someone who studied the literature and someone who actually sees patients every day, other than the experts, 150 sounds about right. Maybe a little higher in some people. Everyone's an individual. I take care of old people. No, I got people who walk around with blood pressures of 170 and 180. And if I get them lower than that, they get dizzy and tired and faint. And guess what? They're in their 90s. So no one's going to sit and tell me that their lives are ruined because we let the blood pressure go so high. In fact, they probably have these little tiny blood vessels. They need the pressure to go up high to get them through the blood vessels. Their body is pushing it up high. And the genius doctors give them medicine and lower it because that's what we do. We like fixing numbers. That's our preoccupation, if you didn't know already. We like making numbers lower. It makes us feel really good. It makes you feel really good too sometimes. So what does 25% mean? In this one study that only looked at people with a high risk of heart disease, here's the number. I'm going to show you this graphic a lot, and I'll explain it in a later podcast. But if you look at a theater of 1,000 people, over 3 years, about 3 people avoided dying in the people who had the lower blood pressure compared to the people who had the higher blood pressure. 3 people of high risk heart people under ideal conditions, perfect conditions. In the real world, it's a whole different ballgame Because in the real world, we shove the blood pressure cuff on your arm and we tell you your blood pressure and it's sky high because you're nervous. In this study, they lied down for a half hour, they took a bunch of blood pressures, probably played them soothing music and gave them massages, not real conditions. But regardless, that's how many people. That's your 25%. Turns out 3 people's lives were saved, which is good for those people. But here's the other kicker. Look at this other graphic. Out of 1,000 people, 12 people had serious complications. This includes 6 people who went into kidney failure, and another 3 or 4 people who had dangerous drops in their blood pressure that led them to go to the hospital. If we look at other studies, there have been several studies before this great sprint study, some which didn't have just 9,000 people but 100,000 people. There was a study that came after the sprint study called HOPE 3, which looked at people not at high risk of heart disease but at moderate risk. And then you look at this graphic. If you look at all those studies, you get a common theme. People with kidney disease, diabetes, people not at high risk for heart disease. This is how many people actually die excessively if you lower their blood pressure below 120. It's about 10 people out of 1,000 in the lower blood pressure group who die compared to people in the normal blood pressure group. So in fact, the bulk of the studies out there show that lowering the blood pressure too much creates what's called a J-shaped curve. So if you lower the blood pressure up to a point, you reduce death, strokes, and heart attack. But if you lower it too much, you get more death, strokes, and heart attacks. Other than this one study. But this is the study the cardiologists cling to because they want to believe it so bad. And there's a cynical way to look at it too. Because by overnight increasing the amount of people who have the diagnosis of hypertension, the label of hypertension, by 30 million people, they have now made 30 million extra people sick. 30 million extra people who have to go see their doctors, who are going to probably take drugs, who now might get stress tests and other well-reimbursed tests for doctors. It's how we feed the system. The more people we can make sick, the more the system flourishes. Which is why we have $1 trillion of excess medical care. So I thought I just wanted to bring this up as a way to just start before we get into all the other stuff about cardiology. I have a thing about cardiology, not cardiologists, but cardiology, because we keep thinking that if we lower the cholesterol, lower the blood pressure, we open up blood vessels, we do stress tests, we're doing good things. And as I'm going to show in the next few podcasts, it's just not true. In fact, sometimes we cause harm. As a geriatric doctor, when I lower my patient's blood pressure too much, they get tired. Their memory gets worse. They get dizzy. Sometimes they fall down and break bones. The people in this one study didn't find any of that stuff. They didn't look very hard. I see it every day, so they couldn't have looked very hard. I see horrible things happen when we lower the blood pressure too much. And because of these new guidelines that the New York Times and other newspapers and news outlets just printed without even looking into the facts, just believing these experts and what they said, real damage can be done. Not only is this going to cost the system more money, but people are going to get hurt because of this. Badly hurt. Because they're going to lower their blood pressure too much and major damage is going to occur. So we got to really take a step back. It's really important when you read the newspaper to understand who they're interviewing. Usually it's people who are experts but have an agenda. And it's also using these relative numbers, these percentages. Cut your death rate by 25%. You got to ask 25% of what? Every time you see those numbers, you should ask that question. If your doctor tells you a number like that, you got to ask that question. Because ultimately, you want to know how many people are hurt, real numbers, how many people are helped, and how does it apply to you as an individual? And that's what we'll get into. So if you've seen the new guidelines for blood pressure, do me a favor, take the guidelines in a little ball and just throw them away because they're bogus. This is just part of the nonsense in our medical establishment that makes it so frustrating to practice in. But as we go through these podcasts, I'm hoping that together we can educate each other and actually have a good way to deal with medical issues that aren't related to all the hyperbole and lies and deception that are being fed to us by the medical establishment. So if your blood pressure is 140 today, you're still good. 150, you're probably still good too. Don't worry about it. Ignore the guideline, and we'll tell you why as this goes on. Take care. Hey, so if you're equally annoyed by our dysfunctional healthcare system and all the garbage you're being fed, then give me an email, log on to my website, which is listed down here. Let me know what you want me to talk about, and I'll just keep feeding you information, and we'll discuss this and hopefully make some changes. See you later.